It's 6 o'clock.
So you can start.
Oh, thanks.
We are live.
I'm online.
Yes, sir.
Yeah, thanks. Okay. Very good evening to all of you. It's a wonderful day. It is raining here in Delhi, and I am here because, like the current pandemic of COVID actually made me stay back in Delhi, and I'm very happy that I'm here because my family is here and my friends are here. And I have been able to be a part of a lot of work that is happening across India in terms of traditional medicine and COVID related activities and COVID response. So I would like to share a few of my thoughts regarding this. I would like to share what and how WHO looks at traditional medicine, especially in terms of COVID, and what is happening around the world in terms of like traditional medicine and COVID, and a few things which we can probably discuss about integrative medicine also. I would first of all like to start with thanking Dr. Akshay Anand for giving me this opportunity to speak in this great platform. Also for Dr. Pooja and Dr. Navneet for coordinating this activity excellently. And a very good evening to all of you. So I would like to start with making this like a statement, which is part of what WHO's Director General Dr. Tedros said in 4th of May. He said that traditional medicine all traditional medicine should be safe and effective. And if they are safe and effective, they should be accepted and as a viable mode of treatment for COVID-19. So that's what he said. It was quite interesting because there was a lot of doubts regarding how WHO would be looking at traditional medicine during this period. But with the Director General of WHO unequivocally suggesting this, making this statement, it was very clear for us that this is the stand which we are taking. Since long time, since more than 25 years, WHO has been very strongly supporting traditional medicine. Traditional medicine, as far as WHO is concerned, is an important part of healthcare across the globe. In fact, WHO considers that in fact, millions of people has only access to traditional medicine, and their healthcare is their first choice of healthcare is always traditional medicine, and for many of them it is the only choice of traditional healthcare. So with this, what WHO DG said was, I could read out what he said. It is on the 4th of May. He said that WHO welcomes innovation efforts around the world in repurposing drugs and developing new molecules in research for potential treatments of COVID. And he said there are several ongoing and foreseen clinical trials that include both Western and traditional medicines in China, India, Thailand, Sri Lanka, Japan, and Republic of Korea, among others. Any drug or herbal therapy must follow strict protocol, no matter which country they are conducted, and subject to tests and clinical trials for quality, safety, and efficacy. And he encouraged all innovators to work together within their national regulatory framework to ensure proper support and ethical approval of these initiatives. This is something which he said. And immediately on the same day, the regional director of WHO from Africa made a statement saying that WHO welcomes every opportunity to collaborate with countries and researchers to develop new therapies and encourages such collaboration for the development of effective and safe therapies for Africa and the world. So WHO has like with this, because these are the two top officials of WHO from different from the headquarters and from the regional offices, speaking for traditional medicine in the use during the use of during the response of COVID-19. In fact, to give a little more of perspective about what has been happening, I should tell you about what is happening in Wipro, which is the Western Pacific region of WHO. There, China, Malaysia, and Japan are seriously indulged in traditional medicine research and related to COVID. In fact, you might already have read in different newspapers and and articles and scientific journals that China has more than 100 clinical trials going on related to COVID and traditional medicine related management. In African region, Madagascar, the president of Madagascar itself came out and said that they have a medicine which has been found to be effective, herbal medicine which has been found to be effective in COVID management, and they are developing it further with along with the help of support from South Africa and Nigeria. So this is what's happening in Africa. In UK, there is an Ayurveda based. There are two Ayurveda based clinical trials which has been registered for management of COVID like symptoms at home. So home management of COVID like symptoms, this which is people who have symptoms related similar to COVID but not been tested and being requested to stay at home, being treated through Ayurveda and at home. That is, there are two studies which has been completed and it's awaiting publication. And in USA also, there is one study which has been registered with the clinicaltrial.gov on COVID-related management, means Ayurveda-related management for COVID. In Eastern Mediterranean region, we have Iran as a strong country where there is a lot of research happening in COVID care using traditional medicine, especially the Pasteur Institute and the and the University of Tehran is very closely associated together and and working in several drugs for the management of COVID. That Iran is right now going through a second wave, and there are a lot of cases. So Iran is very keenly trying to find an answer for this particular situation. The last, but the very important region that I should talk to you about is Southeast Asian region, where India is a part. Nepal has already published a clinical protocol which needs to be implemented by Ayurveda doctors in the management of COVID. So has Sri Lanka. Sri Lanka has been is in discussion on initiating clinical trials on COVID, but the number of patients for them have considerably reduced, fortunately, and they are like right now discussing on how to go forward with it. India is one country which you need to know, because not only because we are in India, but also because India has done major work in COVID during this period. There has been a lot of prophylactic work happening across India. In fact, Government of India is doing a clinical trial, or actually a field-based trial, on including more than 200,000 subjects where they are giving medicines or prophylactic effect on people with on the frontline management of COVID, and then comparing them with an equal number of people. Like it's a huge study. We hope that the study report will be available in another 2 months time, and we will be having some kind of a idea about what had been the effect of traditional medicine in large scale prophylaxis during pandemics. We would have some kind of an idea during that period. And then India has also undertaken several other clinical trials. One is there is a very good very good like a triangulation of three organizations which have come together, which is AYUSH Ministry, the Central Council for the Council for Scientific and Industrial Research, and with the support of ICMR. They have jointly, in fact, AYUSH Ministry and CSIR and the support of ICMR has created a protocol which is being administered on COVID prophylaxis and COVID therapy. This is a very specific randomized control trial which is being done, which is a multi-centric trial, and I understand from very reliable sources right now that there are there is a big chance that it may become a multinational trial where more than 7 to 8 countries might also be participating. So this is very exciting time for traditional medicine in India. Another thing would be the after the request of the Prime Minister of India on his several of the broadcasts to the country during the lockdown period, to utilize Ayush, especially yoga, Ayurveda, and Ayush systems advisories for prophylaxis. There has been a huge demand for an increase of demand for Ayush medicines across the country, and we are actually in the process of understanding how effective that prophylactic large-scale prophylactic medicine communication had been, and what had been the permeability of it across the society, how people have used it, how people have been benefited by it. This is something which is being studied by Ayush, and for that they have come out with a wonderful mobile application called Ayush Sanjeevani, which is available in the Play Store. And it's a very, like, it takes 20 seconds to answer that, and like collects around 7 to 8 questions, and and an excellent app. I think the Ayush Ministry is planning to collect data from 50 lakh people, 5 million people. So and that could be one of the most comprehensive data available on traditional medicine intervention across the globe in a very short period of time. And that is, I think they are succeeding in achieving that numbers. If anybody in this group who is listening to me has an interest, should definitely try to see what this app is, and then try to respond to it. So again, coming back to like COVID and COVID management, I because this is Dr. Akshay Anand is very closely related to integrative medicine, and the yoga activities happening in PG. MIR is also very closely connected to integrative medical practices. I would like to talk about integrative medicine here a little bit in perspective of COVID-19. So here we should understand that there is a clinical intervention that we are looking at. Like we usually, when we talk about integrative medicine, we usually talk about clinical intervention. And I would like to share yeah, okay. So this, I don't know, like, is it full screen? Yes. So when we are talking about clinical integration, there are two different systems of medicine working together, or two clinical practitioners who are working together. These clinical practitioners should understand each other, and they should either have a common language, or there should be common symptoms which are closely understood by these two different systems using their own languages. Like, so this is an attempt which we have done on about 20 patients of COVID, working with in a tertiary care hospital where modern medical practitioners were treating COVID patients, and are still treating COVID patients. We work closely with the modern medical practitioners who are treating COVID patients, and then try to understand how COVID patients really uh, behave. What is the behavior of the disease? What is the clinical outcome of the disease? What is the clinical symptomatology of the disease? Which we wanted to, like, it was quite easy to read about it, but to see and work with the patient and work with another clinician was very important. That was one thing which we were able to do. And from there, understanding and working with the clinicians, and understanding and working with the patients, we were able to make an Ayurvedic profile of COVID-19. So according to us, according to now, it is generally accepted and understood that Ayurvedic profile of COVID-19 would be kapha, vada, adhika, sannipada jwara. It's a kapha, vada, adhika, sannipada jwara. It's a way of understanding the patterns of the disease in the body, and also the pathological process. So this is first of all, it's a fever, and there are involvement of all the three doshas. Probably you have heard about it. Doshas are the three humors in the body, or doshas are the three factors in the body which are self-regulating, and if they are not able to regulate themselves, or body does, if there is major changes in their self-regulatory capability, then we fall into disease. So these are vada, pitta, and kapha. And all three of them usually are not involved in the regulatory mechanisms of all these three factors do not get impaired simultaneously in most of the diseases. In certain diseases they become, and then those diseases, if it becomes impaired, can be very very difficult to treat or manage, or it can be fatal to the patient. So we know that there is a very typical pattern of development of this disease, where it starts as a kapha adhika jwara, which is kapha adhika fever, where kapha is the factor which has been impaired at first. Then in certain cases pitta also gets impaired. Then if pitta also gets impaired, then you have a lot of complications in this disease, starting with high fever, or continued cough, or or you have the cytokine storm, like that's the most typical symptom of pitta vitiation. And then with all these things, vata will also get vitiated, and then patient can go into very serious condition, critical conditions, or death. Whereas if at the very early stage, where you can see in the yellow colored block, if the disease is managed well, then the patient does not progress into critical care or critical situations, and and recovers fully without any problem. So this is one. Then if based on this, actually we can look at a clinical integrative pathway, the same thing. You have several stages of the disease, understood from a modern medicine perspective. And with this and based on the earlier understanding of the disease, we are able to very clearly say what are the medicines to be added into the modern medical management of the disease. For example, in pre-infection, we can start with Withania somnifera, which is an immunomodulant. You can give gargles, you can give nausea, which is nasal application, and you can give medicated steam. Then if there is an if and when the person gets infected with the virus, you start another medicine called as Tinospora cordifolia and Piper longum, which is the medicine which is meant for kapha vada adhika sannipada jwara. And then we continue with that. And if the patient, in case, or even after starting that, if the patient develops mild symptoms, or moderate symptoms, depending on the mildness of the moderateness of the disease, or the symptoms being expressed, or also depending upon the location of the symptom and the kind of the symptom, different medicines can be added to it. And if we have suggested here that if the patient develops severe severe conditions, or goes into a critical case of the to want to become a critical case of COVID, then Ayurvedic intervention should be either stopped or should be continued as per the decision of the responsible physician, who is a person who is a doctor who is managing COVID. And also we can come into picture as an integrative practice during the convalescence stage of COVID management. These are areas where we are actually trying to manage. This is what we have proposed to different trials, and there are many trials which are happening right now in India based on this idea of what we have. Uh, then we have another, and then that is related to clinical care. Whereas another kind of a care, integration that we might have to look at is health system integration, which is the most important thing as far as we are concerned right now. If you look at it, you can understand that traditional medicine in India has been trying to reduce the burden of the health system, basically due to COVID. So this has reduced the burden on the health system by either providing AYUSH prophylaxis to many patients, and also probably providing AYUSH therapeutics to many patients in bringing down severity of the infection. But AYUSH prophylaxis, it seems, has played a major role in this condition, whereas we know that in many states, including starting from Kerala to Goa to Punjab to Gujarat and Madhya Pradesh. In many places where AYUSH interventions had been used considerably on large number of people who are exposed and who are vulnerable to the disease, and has been found to be very effective in prevention of the disease or in prevention of severity of the disease. Very lately, like AYUSH has been introduced into the therapeutics of COVID, and in very specific conditions. So we are not in a situation to say that AYUSH had brought down severity of the infection but there are several clinical trials going on right now, and I hope that the results will be out, and there will be more involvement of Ayush in management of the disease also. And another area where Ayush had been utilized or integrated into the system is to increase support to the in unmet needs. That's another major area where Ayush had been. So Ayush support has supported the health system with its own resources, which includes Ayush personnel who are medical professionals who had studied Ayurveda, Unani, Siddha, or homeopathy, and had been working along with modern medical practitioners on the field in management and supporting their management of COVID-19, providing infrastructure to the health system, and as well as providing finance to the health system for immediate management, by reallocation of Ayush funds, and also in support in non-COVID healthcare delivery in many areas, like especially in several government dispensaries. The number of patients who are going to Ayush treatment, or taking Ayush care during this period for specific diseases like NCDs, which had been usually been managed by their allopathy counterparts, has increased quite a lot. So in some way there is a support which is being offered to the health system by Ayush, by like by supporting the patients who are not getting, or who were not getting the healthcare they were seeking, because the regular doctors got deployed or got like busy with other COVID management programs. That's something which we have to look at. And I already told you about all these. I think I don't have to. So I will. Um, and then another thing which I would like to tell is that in future, where are the areas where Ayush can be integrated into the management of similar pandemics or similar situation. That's something which we should learn from the current situation. One of the areas where I think Ayush had been completely neglected, but has a lot of potential in integrative support, is management of antimicrobial resistance, which of course we know that is going to be a major problem in the coming years with no proper answer. But I think Ayush has sometimes, in certain conditions, very good answer, and that should be looked into. And like similar is the case of viral diseases, other viral diseases. We have millions and millions of cases of common cold and flu in our country, which could be reduced if Ayush interventions are appropriate and and are effective to much lower number. So that is something which they should start looking into. Management of, or support of the health system in management of nosocomial infections is another area which we can look at. So if you start looking in this direction, which Ayush has never been part of, these are several areas where Ayush can start working together with the health system, modern medical health system, and and integrate properly to support it better. Another area is appropriate utilization of Ayush in NCD management, in early prevention, or in prevention and early detection, and early like management of the disease. Like all patients, like we have enough number of patients and we don't have enough number of doctors. You don't require that one doctor to treat 1,000 or 3,000 patients. Like we actually can divide this work. The major complicated cases should be taken care of in the health system by modern medical doctors, whereas I should take care of, or I should focus on taking care of patients in the early phase of the disease, or in prevention and management of the disease in the community level, so that the patient does not have to go to a to the doctor, and and the stress on the health system can be reduced completely. Another area which we have found quite interesting during this period was the use of yoga in as a health system intervention in the management of stress, as well as an alternative for physical exercise. When people couldn't walk out or go out of their houses. So this is another area which was of very interest, and a lot of interest across the globe. In fact, during the World Health Assembly on 18th and 19th of this year, we conducted yoga sessions across all regions of WHO, and it was e-yoga programs. Like, so we had 20-minute yoga scheduled through Facebook, where one or two yoga experts like participated and guided more than 10,000 people across each and every region to practice yoga simultaneously. So yoga had become a major part of what how Ayush is looked at, and Ayush communicates with the international community, and Ayush is expected to be communicating with the international community. In the meanwhile, I should also tell you that since this group has a strong interest in yoga, I would like to tell you that WHO is developing a mobile health application, first of its kind in WHO's inventory, a mobile health application for yoga practice, appropriate yoga practice from home. So it is a kind of a yoga trainer, very simple yoga practices, but something which you can use with the with quite an quite confidence, and can be used by uh, even novices to yoga across the globe. So we are trying to bring it out in all the languages of WHO, of UN, as well as specific languages as the governments might request it. And we also think that this is a big opportunity for Ayush to provide appropriate care to COVID and COVID related problems, because it can lead to self reliance, and also lead to a national pride, which is most essential for our country to progress in the right direction. In fact, this is what I wanted to talk to you regarding, and I'm very happy that I was given this opportunity. And I hope that I had served your purpose of listening to me. If there is any specific questions, I am available for answering them for another 3 4 minutes. And if you have, you can type and send to Dr. Kaur or Dr. Pooja, who can inform me, and then I would try to answer those questions. Thank you so much.